Yo, it's Rick from Rutledge Medical. I get asked a lot how to reprocess scopes. Like, what's the proper steps to actually getting it through a disinfection cycle? The owner's manuals from all of the major manufacturers give you the human standard process, which is actually really long, and there's a lot of it that doesn't apply to animal healthcare. So I'm today going to show you the shortest path to disinfection with any of your flexible endoscopes. Well, everything starts with your need for a basin. In normal circumstances, you would actually do your pre-cleaning wash in a sink where you would scrub the outside of the scope with the scope sponge. You would get the instrument channels with the cleaning brushes. You would do all your leak testing, the whole 9 yards. You would actually do most of that. The leak testing you need to do separate, but most of that would happen in a sink. Then you got the waterproof adapter or waterproof cap. Of course, you're going to have that. Next, it's the any cleaning adapters. Some scopes have them, some scopes don't. If yours has them, you're going to need them. And then finally, the scope sponge and the channel brush. This is going to clean the inside and outside of the scope for the enzymatic cleaning process. And then finally, we've got the lint-free towel to wipe the scope down at the end of the disinfection cycle. So step number one, before you put the scope in any sort of fluid, you've got to do a leak test. So you just came off of a case. Now the scope's ready to be disinfected. You're ready to start the process. Number one, your insurance policy. This is a portable leak tester. Connects to the scope. In this case, we're using as our guinea pig the Rutledge Medical Aurora XP VS 3300s. They're 3.3 meter scope. You can see the waterproof adapter is here on the end of the scope. The leak tester fits onto that right there. I'll just spin it on here. There we go. And now, as you can see, it goes all the way up to 300. Most manufacturers, you're going to want to get to about the 160 range. That's the safe range for you to test the pressures of the scope. So you just pump it up. Keep in mind, too, that some of the leakage testers that are out there include a green arc in the pump measurements, and so that's where you want to stay, is right about in the middle of where the green arc is. So you see at 160, we're not losing anything, we're not losing any air, no air pressure is changing. A step that most people forget, I'm going to set that aside for a second, is that inside the small endoscopes, micro cracks can happen in both the bending rubber, and if you've ever used any instruments in the scope, it's really easy to puncture the biopsy channel that's inside. Sometimes they just get worn out passing instruments back and forth through them, and so they develop these little tiny little micro openings or cuts, if you will, and those have a tendency to leak a little bit, but sometimes you can't tell that the leak is there until you flex the scope. So I always recommend to retroflex the scope in every direction that it can possibly go and to watch the meters. And in this case, we're going to watch to see if this 160 sends us anywhere. It doesn't look like it's going to. So retroflex it the other way. And so far, so good. So we have a clean endoscope. It is ready to reprocess. So we're going to set that down. Now we're going to deflate it. You got to do that manually and slowly. Don't just pop it off the end of the scope. So now that it is completely deflated the interior portions of the scope, you will take the leak tester off, and it's important that you never put the entire scope with the leak tester on in fluid. It is important also to sometimes, I guess probably a once a month thing, is to stick the end of the scope into water, and while you're retroflexing it and moving it around, look for tiny little bubbles while you've got it under pressure. That'll tell you if you've got a micro leak. For a second, let's pretend that the basin is a sink. You're going to take the buttons off. First things first, those buttons are already gone on this case. You're going to fill the basin, a couple of squirts of enzymatic cleaner. You've got your endo sponge or your scope sponge there. So you're going to fill it up above enough in the sink to cover all of the surfaces of the scope while it's submerged. You'll use the scope sponge on the outside of the scope, working really hard to find any proteins that are left behind from the patient, just making sure that you're getting it super duper clean on the outside. Now for the inside, you'll take this beautiful cleaning brush, right, and you pass it down the instrument channel. Now in the case of this scope, it's 3.3 meters long. We're not going to get all the way to the end, so just for demonstration purposes, typically you'd get it all the way out of the tip of the scope and you'd pull the brush back. And then you move to the brush for your buttons and for your suction nozzle. So we start with the suction button. We get in there real good. Most suction, it's going to come out a little crooked for most manufacturers. It's all right. It's not that big a deal. Scrub out your air-water channel right there. And then finally, on the umbilicus end of the scope, you take your big brush and stick it into the suction nozzle, which I clearly cannot get in there today. There we go. And clean it out there. And from here, we be soaking. The scope is going to sit for at least 20 minutes at room temperature using either Rapicide or Cydex OPA. Check with your owner's manual to make sure you know which individual high-level disinfectant is compatible with your individual manufactured scope. Okay, so next you'll take it out of the basin. Then you will use clean rinse water to rinse the exterior surfaces, wiping them down as best you can, doing your best to get all the chemicals off. Then you flush the interior biopsy channel and the suction nipple on the umbilicus side with a 60cc syringe of clean rinse water, and then followed by 2 60cc syringes of air, just to make sure you're purging all of the liquid that's in the scope completely out. It kind of gives you that extra layer of security just in case, you know? Okay, and for your final step, you're actually going to use rubbing alcohol, believe it or not. I can't tell you how often people ask me if rubbing alcohol is okay to use on the scope. Everybody's apparently afraid that it's going to, dry the biopsy channels out, or it's going to dry out the insertion tube. That couldn't be further from the truth. In fact, all of the surfaces of the scope are made out of Teflon. So that's a biopsy channel, the insertion tube, all Teflon. So that stuff holds up to a whole lot of abuse and chemicals and bodily fluids. And rubbing alcohol is not going to do anything to damage it. In fact, all the major manufacturers, Olympus, Pentax, Fujifilm, Karl Storz, they all recommend that you purge your interior channels with alcohol at the conclusion of your disinfection cycle, just before you actually go to store it. I like to take it a step further and add 2 60cc syringes of just plain air, kind of like what I did with the rinse water, to make sure that I got out any possible fluid that was left, and let the alcohol go to work and do its thing. Well, there you go. 9 easy steps to a disinfected scope. We hope you can use this in your training protocols. Feel free to share it with your colleagues, share it with anybody you know in the veterinary world that's using scopes. I don't think a lot of us on the vendor side have done a very good job of making sure you guys stay trained and up to date on exactly what to do and how to leak test, and then things start to get inconsistent, and that's when damage starts. So hopefully this can start to standardize the process as best as possible. We'd love to talk to you more. Find us, endoscopes.vet, 1-888-ENDOVET, sales at endoscopes.vet. And then, of course, you can find us at The Scope Guys on all the socials, including WhatsApp now, except for frickin' LinkedIn, of course, because we're listed as Rutledge Medical there. But we'd love to talk scopes with you. 1-888-ENDOVET or endoscopes.vet. Come and find us. Thanks for watching.